call this meeting of the Gloucester Board of Health to order. It is Thursday, October 12th, and roughly 5:30 in the evening. We are in the Harbor Masters Conference Room, and this is a hybrid meeting. And those who could not attend in person in our small room here can view the meeting at a link listed on the agenda. Let's please go around the room and everyone introduce themselves.
Thor Akerley, member.
Marco Pellegrino, board member.
Joe Rosa, Chair.
Eric Kaplan, vice chair.
Don Gano, board member.
Dominique Curley, Health Director.
Jacob Taylor, food inspector, also representing Bree Gray, housing inspector.
Leslie Whalen, Sanitarium.
Chelsea Goldstein Walsh, Regional Prevention Director. Cindy Junker, Public Health Nurse.
David Tucker, youth development coordinator.
And Leo Leary, Financial Specialist.
Thank you all. Next item on the agenda is an opportunity for the public to speak for up to 3 minutes on an item not on the agenda.
I don't have anybody that's
All
called.
right. Next item is the approval of the minutes for the September 14th meeting.
I move to approve the minutes of September 14th.
I'll second.
And seconds, any discussion, amendments, changes, corrections? All in favor?
Thor, yes.
Marco, yes.
Joe, yes.
Yes.
Don, yes. Meeting minutes are approved as written. Committee reports. Dominique, did you want to
Yeah.
speak to start with?
Give you all an update on what I've been working on for the past month. On the prevention side, I've been partnering with Chelsea's team and the Community Impact Unit, and also the Rose Baker Senior Center Council on Aging to work on opioid abatement planning, to understand what the frameworks are, to evaluate where the money should go, what the monies are, when the monies will be coming. And so we have a nice framework right now that's going to allow us to speak to nonprofits in the area, the city, and others, and hopefully we'll be moving from planning into implementation, get some of those monies to work. 17 years of dollars coming in, over millions of dollars. On the inspectional services side, I went on field drives today, which was great with Jake doing some doing some food inspections. Got to see him in action and understand a little bit more about what that entails. It was fun. I also went on did the same with Bree and did some apartment inspections this month. I've also been working with Leslie to triage and support some of the septic plan review processes and work a little bit more on how we can improve and operate more efficiently across all inspectional services. But in particular, there's a lot of new work that's coming in for subdivisions and developments and the like. So that's been a lot of learning curve. I have been meeting across the city with our former public health nurses, public health directors, and members of the board. So to date, have met with Dan Ottenheimer, Sonny Robinson, Jack Vidras, Claudia Schweitzer, and then also have had the chance to meet with Thor and Eric so far, and we're going to complete that very shortly with the other two board members here. I'm excited about that. I have attended a few conferences, most recently with municipal officials and leaders talking about the new public health post-epidemic and how the state has expectations now of upping the bar for the services that are provided. So learning a lot about that. The whole team here is going to the Maths Health Officers Association, thank you, where we'll be diving into continuous learning across all inspectional services, public health and prevention. And then I have been spending a significant amount of time working on the the process and understanding the process and working with all the parties surrounding the transfer station that has been proposed via Eastern Waste Services, working on process flows, supporting technical review consultants, and most recently gave the city council a briefing, and it's in your packets as well, on the process and what we're going to be expecting. Sorry?
What happened with the meeting?
They didn't get to it. So it was an informational side of things, and it was in the end. So maybe it will come up in the next one, but it was not brought forward in that meeting.
It's now public record, so.
It is public record.
This is a special meeting we're supposed to go to?
No,
That's what I'm
this
No.
is the city council was
Oh.
provided something, but
What happened to the special meeting we're supposed to go to?
that's to happen.
Oh.
That will certainly happen.
Mhm.
Not the meeting that, yes, that was, you can't meet outside of a public meeting.
No, there was a Monday meeting, right? Is that what was scheduled?
Yes, we were
Yes.
gonna have we were going to have a meeting amongst us to sit down and talk through all of the
Oh,
the
okay.
process.
Okay.
And what we are doing right now is pulling together the information to be able to have such a meeting if it's required, but we also feel that the documentation that you've received, and I'm also able to answer any questions that you may have, happy to walk you through it. And should be enough for you to be armed and informed as we head into the
Okay.
planning for that. Also the work that, Eastern Waste Services has provided funds to allow us to do technical assessment outside of our own skill sets, and that is in play, so that information will be coming as well. And then finally, I joined the GMGI internal institutional biosafety committee and has talked with them about what they'll be doing and how I can support them, and also was able to come to the very end of a septic subcommittee meeting, which I also look forward to joining in, and also the biosafety committee. So I've had a very full month drinking from the fire hose, getting to know Common Crow very well, spending way too much money for lunch. Change that paradigm. So, thank you. We can turn it over.
Good.
Back to you, Joe. Thank you.
So let's go to regulatory, Jake.
Okay, during the month of September, we had 3 calls and complaints that needed to be looked into, 31 inspections, 2 violations which needed re-inspection in 12 events. We had the Magnolias Farmers Market, the concerts at the UU Church, which just ended at the beginning of the month, Harvest Music Festival, the Toast to Cure bike ride, the Soapbox Derby, which is a lot of fun, the kids setting up on Roger Street, running up and down the hill, so that's a good time. Sawyer Free Library groundbreaking ceremony, Common Crow Fest, which is basically a customer appreciation. They had a bunch of food vendors, pumpkin painting stations and things for the kids. And then I also attended the Yankee Conference in Northampton, Massachusetts. So the Yankee Conference, it was the 61st annual Yankee Conference in conjunction with the 2023 FDA Annual Northeast Retail Food Protection Seminar. So it was a lot of the USDA, FDA federal inspectors and local health departments that all met and went over lectures, workshops and whatnot. So busy month again this month. Then I'll follow up with Bree in the housing coach. He had 35 units and 29 buildings inspected, 7 calls and investigations, 1 annual safety inspection, 5 housing complaints, 2 general nuisance complaints, and 2 re-inspections. And today she was going around with the building, fire, and electrical departments to do all the annual inspections on all places with liquor licenses in the city. Yep, everyone that has a liquor license needs to be seen at least once a year.
In one day.
No, not in one day, broken down. So she did X amount of them. Next week, she'll be out of the office because she's getting married and whatnot. And so I'll be taking over those ones for her.
Married and whatnot.
Married and whatnot.
that.
And Jake-
Married on, yeah. Oh, I got engaged the
Yeah,
other day,
Jake got
so.
engaged and whatnot.
Yep, I did. I'll show you pictures after the meeting.
Okay.
She got still crying until today. Okay, that's me.
Very good.
Leslie Whalen, Title V Sanitarium. In your packet is a list of activities as well as the approved minutes of the August septic subcommittee meeting. Does anyone have any questions? Not, that's fine.
Leslie is, I mean, the sanitarian always does a lot of work, but past few months, there has been replete with a huge number of new things happening, much more so than is typical than in my experience. And there's a number of issues that I think will eventually bubble up to the board level. But so far, Leslie and her crew, her team, yeah, I wish there was a crew, right? Are managing to deal with all these things that are coming before the septic review subcommittee and inspectional services that Leslie provides. So thank you for doing all that. It's I don't know whether you realized when you joined that it was going to be quite the mountain to climb. But thank you.
I have very much enjoyed on the learning curve. And septic things, they were amazing to me.
We've heard from Dominique. Cindy.
So I have, in your packets, you'll find September's report of communicable disease investigations. There were 92. You'll also see vaccines administered in September. There was 135. I had 3 home visits, 1 public clinic and 5 public housing clinics this month so far. We've done 364 vaccines, flu vaccines, and 11 clinics. And today, the state EEE risk level for Gloucester is remote, and the West Nile virus risk level is also low. The COVID-19 data, which is for the last 2 weeks of September, Gloucester's positivity rate is 10.71. Essex County positivity rate is 9.43, and the state rate is 10.26.
So 10 positives out of every 100 tested.
So the testing rate past 2 weeks for Gloucester is 565.1 for 100,000 residents. That's how they put it.
100,000 residents.
Yeah, we don't have
I know.
100,000. Let's
But if we get-
pray that we don't get 100,000 residents.
Well, the way we're going, we will.
Yeah, they try.
Bigger building.
We have 5 more flu clinics to go.
And speaking of working hard, Cindy, of course, is a part-time public health nurse and has been literally running in and out of the office, trying to make everything happen here, working with her colleague Bridget and another folks that are volunteering and making this happen. So I just really want to personally reach out to Cindy, who's done a terrific job of getting the flu vaccines distributed across our city.
Absolutely. I can speak to one of them personally. The Biotech Academy went
That went very well, yeah.
Cindy and Bridget did a terrific job. So what else? Where are we? Guess we're down to Chelsea.
Okay, well, I'm here with my colleague David, representing the prevention team, which is also comprised of Jan Lieber, our prevention coordinator, and Rosalie DeCastro, who's the program assistant for the Seniors on the Go bus. So I'll be just kind of giving a couple highlights. I know you have kind of a bullet point list of initiatives we've been working on recently. I'll just highlight a few things, and then happy to answer any questions if people have specific things they want me to talk about. I'll say first that our recruitment for Gloucester Youth Leadership Council, which is under David's direction, is going really well. We have a large number of kids who have expressed interest and started to participate in meetings, volunteer opportunities, and a field trip. And that is open to middle and high school students. And that's also open up, it's the Gloucester Youth Leadership Council, but we also presented in Rockport and had a large response rate of Rockport students who were interested in joining as well. So we've kicked off the year. We have another meeting coming up in 2 weeks, and we're really excited. As part of being a member of that group, you participate in meetings and work on public health campaigns to help better the community, and the kids get to decide what the issues that are facing them that are most important to them they want to work on. They also participate in a monthly volunteer opportunity and a monthly field trip. So we just went on the Cape Ann Whale Watch a couple weekends ago. This was fun. Saw some whales. we have the volunteer opportunity for kids coming up on Sunday, October 22nd at Spooky Spindrift, which is a Camp Spindrift event for young kids. So we're inviting our youth leaders to help volunteer at that event. So it's going really well. I also just want to give a shout out to David, who recently attended a meeting for all Mass Call 3 grantees, which is one of the grants we hold out of the Massachusetts Department of Public Health. And the staff there, DPH staff, recognized David for your expertise in working with youth and asked if you'd be willing to lead a training at a future date for other grantees. So that's a huge honor considering. So I just wanted to give a shout out.
Chelsea, is there an email that a high school student can contact if they're not currently on this council but want to do?
Yeah, most definitely. So you can check on our social media, which is Gloucester Youth Leadership Council or GYLC, or you can email me directly at dtucker at gloucester-ma.gov.
Thank you.
No problem.
They can also go through our website too, the Gloucester Health Department website, and through the contact us page as well.
Yeah.
But yeah, follow us on social media.
Friends of teenagers that I can't give you promises, they don't know about this already.
We're always open to new members. There's no like close date, so
Right,
it's
right.
rolling. Anybody can join.
It's huge for schooling, for college, for
Yeah.
private school.
Yeah, exactly, great.
Thanks for asking. A couple other things. So Dan Liebert, our colleague, is leading an after-school program through O'Malley Academy for middle school students about public health and social justice. There are, I think, 7 or 8 students in that group, and they're working on a public health campaign potentially around vaping, that they will be creating posters and putting it up in public spaces. That's the goal by the end of the program, so that runs through December. I mentioned Spooky Spindrift. We have a few other public events we'll be tabling at. One is Community Safety Day this Saturday. We'll be at the Essex Clam Fest because we are regional. The following Saturday, October 21st, we'll be at Spooky Spindrift, October 22nd. We'll be at Drug Take Back Day, October 28th. And we'll be partnering with the Be Healthy Beverly Coalition on Halloween night to host Fright Night, which is open to all middle and high school students. We'll be showing Gremlins at the Cabot Theater. It's $1 movie night, so you get popcorn and a drink. There'll be a costume contest and monster makeup. It's gonna be really fun, and it's intended to offer a substance-free event for young people to get plugged into. I'm gonna stop there. And if anybody has, so there's lots of things we're working on. If people have specific questions, I'm happy to highlight any other things, but those are our main, kind of our main areas of focus right now.
The drug take back happens still at the senior center, is that right?
Yeah, so it's a national event that happens twice a year, once in October, once in April, and we are having it at the Rose Baker Senior Center outside in the back parking lot. We're partnering with Rose Baker and the police department. And we're inviting our youth leaders to help volunteer. They usually have National Honor Society students as well help volunteer. And we encourage everybody to bring any unused medications they want to get rid of, so that they can be safely disposed of.
Right. It's an important thing that people should do. Get unused or misused drugs out of their houses.
What's the date?
It's Saturday, October 28th from 10 a.m. to 1 p.m. And if folks can't attend that day, there are drop boxes available at the police station. That's 24/7, so you can dispose of your unused medications at the police station at any time.
They are incinerated
Yes,
under the watchful eye of the police.
yes, we are not we don't collect the medication after a drug take back day. The police take it to the incineration station, which is outside the community. I think it's in P8.
Good, thank you. The next item on the agenda is concerns of the board. Any comments? Eric has highlighted a concern that he has, and I share it, though it's not obvious to me what we can do about it, and that is, if you watch any TV at all, you see all these ads for, I guess they're called Medicare Advantage, for separate insurance that is being sold to individuals.
Tom Selleck advertises, a bunch of actors that have. Tom Selleck.
No, every company seems to be. And I think there are so many companies because it's quite lucrative. And I think perhaps in the November meeting, we can have a short session on this to learn a little bit more about it. And whether we can do anything more than simply advocate for changes in the law.
Somehow let people know.
And let people know how to best minimize, if they want to take advantage of these things, there are ways of minimizing their financial exposure, if nothing else.
So this is health insurance designed to overlay on the Medicare coverage?
Yeah,
I've belonged to a national program for years, it's PNHP. It's Physicians for National Healthcare. One of the things that they're really pushing is this, trying to get people not to join Advantage plans, which are terrible, essentially terrible. They're great if you're healthy, but if you become sick, you don't want to be in an Advantage plan. It's very bad.
so let's hold that off, the discussion about that until November, when we can put together something a bit more.
Given that it's open enrollment, I do know that the Rose Baker Senior Center offers counseling to any citizen that needs it. So, within their, I think it's 50 and above, or 16 above, and 50 above if there's a disability, they're standing by, they have people that can help. So I think at a minimum, letting people know about that would be an important thing to do.
Anything else? Dominique, did you want to highlight anything or?
Well, the only thing I want to be sure of is that everybody has had a chance to have a look at the documents that were sent out on
Right.
Conlin Road, and in this forum, we can't really talk about any of the details, but I'm hoping that everybody's read them. I want to be sure you know that I'm happy to explain any parts of the process or answer any questions that any of you have. And Joey, is there anything else you'd want to add there?
I don't have anything in front of me, if you know off the top of your head what the sort of the rough idea of the dates when
Sure.
things are gonna happen.
Yeah, and it's actually in our packet. Happy to have to review that now. So this was the document that we had sent to the city council as well. It's sort of outlines what we're facing, or what we're going to be asked to attend to. So Eastern Waste Services has applied for a site assignment, has put in a site assignment application with the Department of Environmental Protection to handle 325 tons per day of construction and debris with maximum annualized capacity of 101 400 times 400 tons. It's going to sit in a facility up at 24 Conlin Road on 1.5 acres. It's going to operate 6 days per week, 12 hours per day is what they're proposing. And that application has been submitted to the DEP as of August 11th. As of September 7th, the DEP certified that their application is complete, meaning that they have filled out all the sections that they have to fill out. From there, on September 26th, the DEP further certified that Eastern Waste Services had allowed everybody to know about it. So they published a notice in the Gloucester Times and in our neighboring town of Manchester by the Sea. And they have copies at the library. So now the DEP says, all right, you've now notified everybody this. Now we're going to take that under review. So that's where we are right now. So that started on September 26th, and as of October 17th, that during that period of time, they're accepting public comments. They will then take those comments into account, and within 60 days, on or about November 27th, we'll be giving a certificate, kind of saying that, yes, you were approved for this in their eyes, but it doesn't really get approved until the Board of Health votes it in, and that's where you all come in. So as soon as they have, said that they approved the application, if that happens, then we have 30 days to hold a public meeting, a public hearing rather, excuse me, on site suitability. That hearing is led by a named party that you all unanimously vote in, and there's some folks that we've been sourcing to make sure that they're qualified to run. It's almost a judicial proceeding. And they will, so on or around December 28th, we'll have that public hearing. And then within 45 days of the first date of that public hearing, it might run multiple days, be continued depending upon any questions that you might have. That we have to, you all will then vote and say yay or nay, that you have two sort of answers that you can give. Yes, you're approved, or yes, you're approved with conditions, or no, you're not approved because of the following reasons. And those reasons are based on very specific criteria that are called out in law that you all are evaluating. That's in the document set that is sent to you by me. Again, I'm happy to call out and tell you exactly what sections are of the law that you need to look at to be sure you're prepared. And what we'll be doing is bringing forward any information that we have from our independent technical review of their application to sort of give you the details that you need to have to be able to hold the public hearing effectively. Is that helpful?
Good. So more to come on this, but in the meantime, there's some publicly available filings that have been made. You guys can read up on it. If you don't have what you think you should have, either communicate with me or Dominique.
And at that site, there's already a recycling disposal center, right, by Hills? There's already a.
We're unfortunately not able to talk about it right now. Yeah, so,
But-
but
no.
the answer is,
We can't deliberate on it,
Yeah.
but to answer your factual question,
There's already
yes, it is.
existence.
it's separated recycling at this point.
So a lot more to come on, or I shouldn't say necessarily a lot more, but decisions will be made, so there will be a usual meeting of the board that won't be run by me, it will be run by a separate person. And we will vote and ask some questions. So-
Or differently, will we be able to discuss it?
Oh, absolutely, at that
Yes.
meeting, we can discuss it to our heart's content. So,
At some point, we need to talk.
yeah, exactly.
I have a question for Cindy. Cindy, when you say disease status is revoked, does that mean the diagnosis has been changed, or the patient's been treated and it's now?
No, that just means that they have revoked the case. They decided it was not a positive case, so.
Okay, so
Yeah.
it's.
So we investigate it and then they investigate it. After I investigate it, it goes back to the state and they investigate it again and they either confirm it or revoke it.
So babesiosis, for example, it's very specific, you have to have, virology, not virology, but cortisol diagnosis, or how is it incorrectly diagnosed, for example?
So as far as I know.
These are laboratory
It's
confirmed.
lab, they're all
Right.
laboratory
So-
confirmed, so it's probably prior to, it was probably a suspect case.
Oh, so a different.
And then when the, all of the lab work came back,
Okay.
then it was
Okay,
revoked.
all right, thank you. So that person would see their PCP, and somehow is that how this?
Some people are seen in the ED, some people are seen by their PCPs.
So why does the hospital report it before it's been confirmed then?
The,
I'm just curious, like, why would there ever be a revoked status?
there's revoked statuses all the time.
Yeah. That means the clinician was wrong.
Well, because those are suspect cases, so
Yeah.
so in the beginning of the
Okay.
investigation, it's a suspect
Got it,
case.
yeah.
And then we get more information and then all of the labs come back and then we either confirm it
Okay.
or they revoke it.
So they,
Um,
so they So they have to report it if they.
Exactly.
That's all.
And so that is so that some things don't spread more and we can,
Then it's.
Yeah, it's especially important for highly virulent.
yeah, so if these are communicable diseases, so what we're trying to do is make sure that if something is communicable, we catch it in the beginning, so not more people are affected.
Okay, thank you so much.
Anything else? Motion to adjourn,
So moved. Second.
all in favor?
Thor, yes.
So.
Thank you all.
I love these efficient meetings.
I know.